Understanding high blood pressure, a conversation with Mr. Jones. The following conversation involves my patient, Mr. Devon Jones, a 40-year-old African-American male with a long-standing history of uncontrolled hypertension. Both of his parents died from hypertension, and his mother also had type 2 diabetes. Mr. Jones is a police officer in a high-crime neighborhood. He stopped smoking about 5 years ago when diagnosed with hypertension. He states that he drinks several beers every evening and does not pay much attention to his intake of sodium, fat, or carbohydrates. He does not exercise regularly, with the exception of required trainings for his job. His weight has increased by 20 pounds during the past year, and he reports some shortness of breath with activity, especially when climbing stairs. Hi, Mr. Jones. Thanks for sitting down with me today. Let's talk about your blood pressure. What's going on inside your body, why it matters, and most importantly, what you can do about it. So first, what is blood pressure? It's the force of blood pushing against your artery walls as your heart pumps. When that force stays high for too long, it starts causing damage. That's called hypertension, or high blood pressure. There are 3 main types of hypertension I want you to know about. First is primary hypertension, also called essential hypertension. It develops over time and doesn't come from one specific cause. It's linked to things like genetics, stress, diet, and lifestyle. For example, African Americans tend to develop it earlier and more severely. Because both of your parents had hypertension and your mom had diabetes, you're at high genetic risk. Second is secondary hypertension. This is high blood pressure caused by another condition, like kidney problems or hormonal disorders. It usually comes on more suddenly. Right now, it sounds like yours is primary, but we'll keep an eye out for anything else. The third type is complicated hypertension. That's when long-term high blood pressure starts damaging important organs, like your heart, kidneys, eyes, and brain. Let's talk about your situation. You've had high blood pressure for years. Your family history puts you at high risk. You've gained weight and don't exercise much. You drink several beers a night and eat salty foods. And now you're noticing shortness of breath, especially on stairs. All of this tells us your heart may already be under too much pressure. Here's one possible complication: left ventricular hypertrophy, or LVH. When your blood pressure is high, your heart has to work harder. The wall of your heart's main pumping chamber, called the left ventricle, gets thicker. At first, it might seem like it's getting stronger, but over time, the thick muscle becomes stiff. It can't pump as well. That leads to symptoms like the shortness of breath you've noticed, and eventually, it can lead to heart failure. The good news is you can take control. Here's how. Cut back on alcohol, try a few days alcohol-free, or stick to 1 to 2 drinks max. Lower your salt intake, read food labels, and avoid salty snacks and processed foods. Move more. Just a brisk 30-minute walk most days helps your heart. Lose a bit of weight. Even 10-15 pounds can lower your blood pressure. Take your medication every day, even if you feel okay. Mr. Jones, you've already taken a big step just by learning more today. You're not alone in this, and with the right support, you can protect your heart and live a healthier, longer life. Let's take it one day at a time, starting now. Talk to your healthcare team to build a plan that works for you. The information in this video comes these references.